Hi, everybody. Welcome to the course. This is Holistic Health, an introduction to complementary and alternative medicine. So, to start off, I want us to imagine a hypothetical situation. So, consider this that the vast majority of disease in our culture is preventable and or reversible using fairly simple, very affordable, and effective, scientifically based, completely all natural methods. So, if this was really true, who would benefit from suppressing this information? So, in other words, if all the disease is really preventable and we could live our lives completely disease free using very simple, very affordable, completely all natural methods, who would benefit from suppressing that information? So, the first people that would come to mind are the people that actually treat us for the disease. The conventional medical system, what we refer to as allopathic medicine. And they primarily rely on pharmacology and surgery to treat disease. In this country alone, we spend almost $3 trillion a year using allopathic medicine to treat disease. The pharmaceutical industry. Pharmaceutical industry is a leading financial contributor to medical schools. The industry has a great deal of influence over the medical system and the way that medicine is practiced. And they also have a great deal of influence over governmental regulations. We spend $300 billion a year on pharmaceuticals. So that's again, we spend $3 trillion on medicine. About 10% of that is spent on pharmacology. So most people are surprised at that. They think it's more like 50 or 60%, but it's only 10%. The food industry. Overproduce food filled with fat, salt, sugar, chemicals. That food is absolutely making us sick. There's no question. It's been linked to everything from obesity, diabetes, and cancer to acne, asthma, and allergies. I find it ironic that on fast food alone, we spend $300 billion a year, which is the same amount of money that we spend on pharmaceuticals. So the food industry have a very big financial incentive in essentially feeding us food that's going to keep us sick. Nutritional supplements. Now, there are some nutritional supplements that can be helpful, but overall, what they're doing is offering an alternative to eating healthy food. And we should really, in other countries, they consider that a little bit ridiculous. I mean, why should you get your nutrients from pills when you can just be eating healthy food? We spend about $60 billion a year on nutritional supplements. About half the population uses these supplements. The mass media outlets. So CBS, ABC, CNN, Fox News, they deliver the messages from those various industries. And they are financially dependent on those industries. So you need to think about it when you're watching a news report on CBS or CNN or ABC, and they do a report on the latest medical treatments. And then they cut to a break and you see a commercial for the pharmaceutical industry, followed by a commercial for McDonald's, followed by a commercial for Budweiser. Can you really trust that media outlet to give you accurate information that is going to really benefit your health? So the fact is, these industries are profit driven. The bottom line is always most important. Now, to be fair, again, especially to the medical community, a doctor can talk until he or she is blue in the face about the benefits of healthy eating, and the patient, probably 8 or 9 times out of 10 is just going to nod their head and just ask for the prescription. So it's not always the doctor's fault. But the fact is, medical schools do not teach nutrition. Most doctors are not educated at all in preventative medicine. And the medical community as a whole has been, I would say it's fair to say that they've been negligent in really promoting proper diet the way that they could. So the messages that we get from these industries are not always in the best interest of your health. So in this course, we're going to focus on how you can live a perfectly healthy life, completely independent of artificial and expensive medicines. And it really comes down to 3 things: eating a healthy diet, getting enough exercise, and learning how to manage your stress effectively. And unfortunately, a lot of these industries have convinced us that this is alternative medicine. And I really am still dumbfounded by this idea, but most of what we know about alternative medicine is really preventative medicine. It's really about taking care of yourself so that you don't get sick. And we put this label on it as holistic medicine. And of course, most people think it's weird or strange, but the fact is, it's learning how to take care of yourself so that you do not get sick, and therefore do not need to rely on the food industry to provide you with food that's going to make you sick, or the pharmaceutical industry to essentially use drugs to counteract the negative effects of that eating that food. It's not strange, it's just prevention. This is what we're going to be talking about for this course. Proper diet, regular exercise, and effective stress management techniques. And then environment plays a part as well. So eating a very healthy diet, plant-based diet, so mostly plants. A little bit of meat is probably okay for most people. Regular exercise, so engaging in physical activity on a daily basis, at least 30 minutes a day. Doesn't have to be triathlons. You don't have to do anything real extensive. It's just 30 minutes, a brisk 30-minute walk every day is enough for most people. Learning how to manage your stress effectively can prevent and reverse things like depression and anxiety. In this culture, we have this idea that depression is the result of a biochemical imbalance, and that has proven to be a myth. The experts in the field completely discount that theory anymore. So depression is not the result of a biochemical imbalance. There's a whole slew of potential underlying causes for depression and anxiety, but the biochemical imbalance theory is probably not true at all. And then, of course, your environment plays a part as well. So that could be things like the pollution in the air that may contribute to things like asthma or allergies. Could be something like climate change. Or it could be just the environment that you live in that may be promoting an unhealthy diet. So the household that you grew up in, did they really have healthy food, or were they, like my family, did they, eat a lot of unhealthy food? The school that you grew up in, did they really teach you about proper nutrition? And did they back it up by offering healthy foods in the cafeteria? Did they have a really adequate and effective physical education program? That, all 4 years of high school, did you have physical education every single day? Most people don't. And then, again, going back to school, did the school provide, was that school an appropriate learning environment for your particular type of learning style? And a lot of people get very stressed out at school because, the school focuses on a very narrow agenda, and a lot of people just aren't. That's not really suitable for a lot of people. So these are the three main things that we're going to be talking about: nutrition, exercise, stress management. We'll talk about a lot about environment as well. So is this hypothetical situation really true? Is most disease preventable or reversible? And the fact is, it is, without a doubt. The Center for Disease Control estimates that about 75% of our healthcare dollars are spent on treating chronic conditions like cancer, cardiovascular disease, diabetes, arthritis, obesity, and respiratory conditions. And if we just eliminated the four main risk factors, poor diet, lack of physical activity, smoking, and excessive alcohol consumption, about 80% of those conditions would be prevented. So cancer, we keep hearing about the genetic link to cancer. The fact is 90 to 95% of cancer is preventable. Same thing with cardiovascular disease, about 90% preventable. Diabetes, arthritis, all preventable and reversible using a very healthy diet along with exercise. Obesity, obviously, respiratory conditions, things like asthma and allergies, COPD, they are all very treatable with a healthy diet and regular exercise. So some of the things that will respond very well to complementary and alternative medicine: depression, anxiety, allergies, arthritis, cardiovascular disease, some form of cancers. Prostate cancer in particular has been shown to actually reverse using a very healthy diet. Potentially, possibly some other forms of cancer as well, low-grade cancer. Headaches can respond very well to certain things. Back pain, any type of pain management, it does very well with complementary and alternative medicine. And some autoimmune disorders as well. Okay, so what are we going to be talking about this semester? We're going to start off with nutrition. Move on to exercise, stress management, and then we'll get into mind-body medical techniques. We'll talk about massage and body work, Chinese medicine, medicine from India, botanical medicine, which is herbal medicines, which is really a kind of a side branch of nutrition. We'll talk a little bit about homeopathy, and we'll also talk about holistic psychology. Okay, so again, basic premise of this course is the prevention of disease through appropriate lifestyle choices. Okay, I hope you enjoy the course.